Hey, everybody, welcome back to the Modern Customer Podcast. I'm your host, Blake Morgan. Today's episode brings me to Qualtrics X4 Annual Conference in Salt Lake City. I had the chance to sit down with Heather Brace, the Chief People Officer at Intermountain Health. Heather leads strategic oversight of human resources. She is a consummate healthcare executive with more than 20 years of leadership. Today, we're talking about the link between customer and employee experience. We're talking about how doctors are now using AI and what the change management piece of that has been like for Heather. Please enjoy Heather Brace. Heather, welcome to the Modern Customer Podcast in Salt Lake City today at X4. Welcome to the show.
Thanks, Blake.
So I had the pleasure of seeing you speak yesterday for the media and analyst track, and you had such a compelling story that I really wanted to bring you on the podcast for my audience. Can you talk about what you do as Chief People Officer at Intermountain Health?
I'd be happy to. I'm the Chief People Officer for Intermountain Health. We are a large integrated health system based here in Salt Lake City, Utah. We have 68,000 employees. We are in 6 states in the Intermountain West, about 600,000 square miles that we cover.
So healthcare is such an interesting industry because there is no other industry that feels as personal as our health. And I think yesterday you had us all raise our hand, like who had been to the doctor in the last year. It's like everybody. Managing the staff of a hospital is really, really tough. But I can't think of a more important pursuit than creating a great employee experience, which directly correlates with customer experience and patient experience. What are the things that you do to try to create a great customer experience through employee experience?
Well, it's kind of interesting because with 68,000 employees, we also provide their health benefits through Select Health, who's our insurer. And our mission of helping people live the healthiest lives possible is not just for our patients, it's for our employees as well, because they are consumers to our healthcare through both their health insurance and through patients in our facilities. So it's very connected. I always say our caregivers, which are our employees, we call all of our employees caregivers, our caregivers should be the first recipients of our mission. That if they receive our mission in the way that we want our patients to receive it, then it should tie really nicely to how the patients receive it. So they're the first recipients of our mission. And so that alone makes the value proposition of employee experience to consumer experience one that's easily translatable.
Well, let's level set on employee experience. What does employee experience mean?
You know, I was just talking to someone else. The way I look at employee experience, traditionally, organizations used to measure or monitor employee experience through one survey per year. That was pretty traditional. And that's not very telling because when people are answering a survey, they're thinking about what happened to me in the last week or the last month, but it probably doesn't go beyond that. And I've always thought about employee experience as a series of employee sentiment. How do you feel at any given moment throughout a period of time? So if you take a whole year, how do you measure how you're feeling inside the organization at any given time? And if we really want to be accurate about that, we've got to do it more often than one time per year. So about 7 years ago, correlated to about the time I took the Chief People Officer position, we started managing and monitoring our employee experience much more frequently. And we do 3 full surveys per year, and then a series of spot surveys throughout the year just to measure, making sure that we're measuring that sentiment all through the year, because we want to really correlate it to things that are happening inside the organization. And over time, looking at it in aggregate to say, okay, what is the experience? What does it mean to work at Intermountain Health by understanding what that experience is through a series of questions?
So I remember yesterday you were talking about when you opened up comments to all staff and how the managers like freaked out. And at first they were really upset. It kind of reminds me of social media, how people feel very comfortable saying anything. So what was that culturally? What was that like when you opened up? And maybe you can explain the technology that I'm referring to when you opened up comments.
Well, let me take just a step back. I would say, like most organizations, we saw employee experience surveys as HR's job. HR managed the survey process. We sort of kept all the data to ourselves and handed things out. And Once we started making employee experience a conversation, having a manager having a conversation with their team about the results, we really started seeing a different kind of impact. So Qualtrics, when we started with Qualtrics with our employee experience surveys 2 years ago, we made a decision to turn on visibility to the verbatim comments that employees would put in for their team or their leader. And it really made a lot of our leaders very nervous because, in some ways, reading the comments, your feelings can get hurt or it's hard to read sometimes. But what we wanted leaders to do is use that as an opportunity to have a conversation. What makes you feel this way? When things happen in this team that lead to that, what could be different? It's just asking a series of questions. And now that we've been doing it for a couple of years, I think managers have settled into it and making an ongoing conversation. They own their engagement. They own the action plans that come out of the engagement surveys. And it's turned it into something that's real for their caregivers. We use a framework where we call listen, learn, act. Listening is the survey. Asking the questions, like using your team and going through and asking the question, that's learning. And the most important point is acting. What are you doing with the results? Like you've got to act on them and close the loop. So just that framework and really helping our leaders understand more transparency, make it a conversation, it's really changed how people see engagement in the organization.
So for the last few years, we've talked a lot about the consumerization of health. And I believe you changed your name to talk about health rather than just like care.
Mm-hmm.
So now understanding that we're in this time of the consumerization of health, that it's also about what happens outside of the hospital. Do you have any thoughts about the big picture, the future of healthcare and where we're headed?
Well, healthcare is kind of interesting because most of it is driven through your employer, by your insurance, where you go. But as time is changing, people are becoming more choice-based. They can think about Amazon opening up things around healthcare, Walmart, CVS, other, ventures that are coming in the healthcare space. Those things are going to allow more choice for people. And as people make choices, they'll make choices based on the experience they have. And so I think we've thought about it very different in healthcare before, and we're now having to shift our thinking to say people do have choice. And when people have choice, we want them to be their choice. So how does that change the delivery of the service? How does it change what it feels like to show up to a clinic or a hospital? What does it feel like before you show up? How does it feel afterwards? And how does the continuum, the journey, get connected together? So we're beginning to think about moments that matter, not only for our own employees, but for our patients and consumers as well. What does that whole journey of health look like? And healthcare is a piece of it, but it's not the whole piece.
And you were talking about yesterday in your talk about AI and some of the ways you're actually applying AI to create a better, more even consumer grade patient experience, like when you see a doctor and the doctor turns their back to you to take notes, but now AI can actually listen and take the notes so the doctor can make eye contact and be more present. How has that experiment been?
Well, it's very successful so far, and we've really not forced it on people. We've tried to use it, let people play with it, and then now we're starting to get a lot more people asking for it. Because doctors are just trying to be, or providers in general, because it's not just doctors, advanced practice providers as well. They're trying to be efficient in the moment. They're taking notes while you're talking so they can capture everything. And in healthcare, those notes are really important because they drive your diagnosis, they drive your care, they drive the payment. So you want that to be captured in the system. But when a physician turns around and they're typing on the computer and you're talking, sometimes that can feel you're just talking into the abyss. And is the person really listening to me? Do they care? Am I getting eye contact? And we're finding now through ambient listening mechanisms, you have a phone, you lay it down, it captures everything, it can put it in the chart. It allows for more personal interaction. And that's really important in the patient-consumer process is, am I feeling heard? Am I feeling listened to? Is someone paying attention to the cues beyond just what I'm saying? So we are beginning to see a lot more providers ask for that.
Well, I think that is such a great idea. I love that idea personally. And I'm really excited for all the innovative stuff that you're doing. And I'm wondering if you are game for some quick fun questions now.
Okay.
That we did the more businessy questions.
Sure.
Are you ready for some rapid fire fun?
Go for it.
Okay. All right, Heather. Best meal.
Best meal. I love Indian food. Anything Indian.
Okay. If you could have lunch with anyone dead or alive, who would it be?
Oprah.
Okay.
I love Oprah.
Okay.
I always wanted to be her, like talk show host here, but I just think she's an amazing female leader, and I love how she can engage on sometimes very complex topics in a way that's very human. So probably
Nice.
Oprah.
Okay.
Seems like she'd be fun too.
Yeah. Idea of perfect happiness.
Idea of perfect happiness. Are you talking about like just in a moment of happiness, or just
whatever that means to you? Could mean anything.
I am most happy when I'm by the lake with my family. So if I think of my happy day, it's 4th of July on the boat, everybody having super great day, sun, food, and family.
How do you deal with managing stress?
How do I deal? Well, 2 ways maybe. I love my dogs. My dogs can take me down really, really quickly. Just unconditional love. And I like to read. When I read, I feel like I can go somewhere else.
Those are great answers. And lastly, if you could summarize your life motto in a few quick words, what would they be?
My life motto in a few quick words: don't take yourself too seriously.
Yes. So cool. Love that. This has been so fun getting to know you. Thanks for being on the Modern Customer Podcast.
Thanks, Blake. This was very fun.
And everybody, thank you for tuning in. Until next time. Thanks for watching. Please don't forget to like or subscribe and follow my social content on other platforms where I post content daily, including X, Instagram, LinkedIn, TikTok, and more.